Dr. Craig Sussman and Dr. Angela Collier join us now to discuss the new state-of-the-art neonatal center at Orange Park Medical Center. And this is timely, guys, because in July we had the number one month for all the babies born at Orange Park?
It was a busy month.
now you're actually an OB, right?
Right. I'm an OBGYN with North Florida OBGYN, so
okay.
One of the largest groups at Orange Park, midwives and physicians.
Excellent. And doctor, what is your specialty exactly?
I'm a neonatologist, so take care of any high-risk critical care infant.
Okay, and tell us then how both of your specialties work in tandem with this new facility that you guys have.
So we are prepared, the nurses, staff, and physicians and midwives, we take care of, obviously, the pregnant patients.
Sure.
We are able to take care of some of the highest acuity patients. Certainly if there are medical issues that necessitate an early delivery, or if there are neonatal or fetal issues that arise, then we're very fortunate to have the facility we have at Orange Park.
Now, let me ask you this, doctor, what kind of a heads up do you get on something like that if there is a problem in utero with a baby that's about to be born? How soon can you tell that there may be a problem with a developing fetus?
I mean, it could happen any second. So it could be something that the OBs are following closely throughout the whole entire pregnancy, or something that they come in for their visit, and right then they find out there's a problem, they need to deliver right away. So we need to be prepared 24/7.
So anything can go wrong. That's why we have those checkups, and if anybody's been through, we're having a child, that the heartbeat and all that stuff is regulated so quickly.
Right, and I mean our labor and delivery triage unit is sort of like it's an OB-ER. So we manage. Some of them are minor issues, but certainly a lot of complex issues. And as Dr. Sussman said, a woman can come in and we quickly find ourselves in a situation where we need to be promptly delivering and having the facilities, the abilities to take care of these early or ill babies is an essential feature of a hospital.
Approximately how many of these are C-sections and how many are actually vaginal deliveries? I'm just curious.
Tell you.
I just wonder because I think it's the C-sections always seem to be. They always seem to be going up.
I do more vaginal deliveries than C-sections for sure. But I wish I could tell you the numbers.
Yeah, right. But the main thing is once they're born, your job then is to keep them healthy, and you guys have everything there. Tell me about what you guys are able to do with this new facility.
Sure. Well, we're staffed there 24/7 with excellent neonatal nurses, respiratory therapists, nurse practitioners, physician assistants, and neonatologists that are there around the clock, ready to go if any baby needs any type of intervention. We're licensed as a level 2 neonatal intensive care unit, which essentially means we can take care of, resuscitate, manage babies that are 1,000 grams or more, which is about 2.2 pounds or 27 to 28 weeks of pregnancy.
And what are we looking at there in the picture, guys, while we have that up?
Actually, so that's one of our labor and delivery units. That's been remodeled since there is a fetal warmer, bed,
okay, the fetal warmer's on the left right there, and that's where the baby would go.
And the bassinet,
sure.
And it's really important rooming in so the baby and mom always stay together unless there's any issue that arises.
Exactly, and that's real important for that initial bonding that happens between the mama and the baby.
Of course.
So, and then this is I guess just the nice area that you guys have.
The renovated hallways.
Very nice. Delivery. It doesn't look all medically, right?
Right. It's a community hospital with important features.
And what kind of thoughts would you like to let people know in terms of the quality of the expertise on how well equipped you are to handle an emergency situation should one arise?
Sure. Yeah. So as I mentioned, we have all the equipment, all the skilled staff. Ancillary support, everything we need to take care of those patients, and once again, we're there 24/7 whenever needed. We do our best to keep the babies and the moms or the families together, at all costs. But if they need any extra assistance, we're there. Great group of neonatal nurses that are going to take care of that baby just like it was their own family member. So I think anyone that does deliver there, we do our best to make it a family-centered unit, a great experience for you. But if there's any issues that arise, we're there to help you.
Okay, now what does a level 2 NICU, a NICU, what does a level 2 mean?
Yeah, and I alluded to that a little bit earlier with the weight. So any baby that's more than 1,000 grams, or about 2.2 pounds, we're able to support there, keep there, and manage.
Okay, are you guys seeing that more babies are needing care in the NICU unit than you did a few years back? Is there a trend in any certain way? I'm just wondering.
Prematurity on a whole is a little bit less. You know, we've decreased that by 1% or 2% over the last few years. We're able to keep smaller babies alive. You know, the edge of viability has decreased, so we are able to keep younger babies alive these days. So those numbers have made it slightly increase. But overall, I think the OB care has improved. So a lot of those babies that might have been delivered early and needed extra help don't necessarily need that anymore.
Okay, that's right. OB care has increased, it's gotten better, and that's because of her. Listen, guys, thank you so much for coming in. Any final thoughts that you'd like to leave us with?
We're just thankful to have Orange Park Medical Center as our center in Clay County. So,
And I think the public's probably thankful to be able to have that level of quality as well. So, Dr. Collier, Dr. Sussman, thank you both for coming in today, and we hope to see you back next time.
All right, thank you for having us.
Okay, you bet. Up next, 904 Thin and the Nutrimos program. We will be right back in just a moment.